My name's Adam Winstock. I'm the founder and director of the Global Drug Survey, and I just want to run you through a couple of the highlights from the Global Drug Survey 2014. It was a stunning participation rate. We had almost 80,000 people from around the world, and we've just highlighted 10 or 15 of the countries where we had some pretty good numbers. I'm going to now present you pairs of slides. The first set of each pair, those countries where we had more than 1,500 responses, and in the second slide we've got those countries where we had between 600 and 1,500 responses. We use anonymous online surveys. It's not a random sample. This is a self-nominating group of people, and therefore caution needs to be exerted in terms of generalizing our findings to the rest of the population. One of the things that we've become really interested in is to look at acute drug harms. Now that's kind of important because it's the thing that is most likely to affect people today and tomorrow. And a really good measure of acute drug harm is whether or not people need to seek emergency medical treatment. And so we asked everybody who'd used all the common drugs in the last year whether or not they had sought emergency medical treatment in the last 12 months after using that drug. And I think it's a really important thing to ask, because not only does it kind of give you an idea of the measure of the harm that happened, but actually going to hospital, particularly if it's in an ambulance, is a really expensive thing. So we're always interested in getting information out to people that doesn't just reduce their risk, but that can also help governments reduce people's risk of turning up to A&E and using really expensive resources. I'm going to walk through this slide carefully because I think it's kind of scary. So the pink line is alcohol, and as you can see across the board, and we're talking something like 65,000 drinkers from around the world, over 1% of people had said they had attended an emergency medical department in the last 12 months as a result of their drinking. Now, there's a pretty wide variation between the countries that did that a lot and a little. So the drinkers who were least likely to turn up to hospital, actually, the Swiss and the Germans, about 0.6%. And if you compare that with over 2% for the Republic of Ireland, you start thinking, what is it about the way people drink that gets them into A&E? Now, the majority of people who turn up to A&E with alcohol are turning up there with accidents, trauma and violence. But interestingly, an awful lot of people said it took them more than 2 to 3 weeks to get back to normal, and we suspect that with broken bones. Now, cannabis is a drug that everyone, particularly people who advocate for regulation, say is a pretty safe drug. And yet, what we see is that in some countries, we're getting fairly high rates of people presenting for treatment. Now, although globally, it was only 0.5% of cannabis users were seeking treatment, in some countries such as Germany, actually, it was an equal rate. Now, what's interesting again is that the rate of people seeking treatment actually varied enormously. With the lowest rates being in the Netherlands and actually the highest rates being in a country like Germany. Now, we don't quite know what it is about those countries using cannabis differently. Is it a different sort of cannabis? Are they smoking it in a different way? I mean, certainly when we looked at this data, there wasn't anything obvious. But that's something that probably is worthy of a little bit more study. And then we've got MDMA. Now, MDMA normally hits the front headlines when people die, but of course a lot more people seek emergency medical treatment on MDMA than, fortunately, people who die. And as you can see in America, we've got over 0.8% of people seeking treatment. That's almost 3 times the lowest rate of seeking MDMA treatment in countries such as Switzerland. Now, again, if that's because people in Switzerland use the drug more safely, the drug is a better quality, it's really difficult to know. But again, all of these things lead into our interest in helping promote safer drug use. Because what these slides say more than anything else is that for 2% of people who use drugs, they're turning up to A&E, and that could be potentially life-threatening. Now, one of the things that our colleagues asked us to look at was not just to focus on harm related to drugs in terms of physical risk, but to start looking into the fact that actually buying drugs from the criminal market can sometimes be a really risky thing to do. And so we were asked to look into whether or not people were exposed to violence when they tried to buy drugs in the last 12 months. And I'll be honest, I was imagining that this would be an uninteresting question with only 1 or 2% of people reporting exposure to violence. But actually, that doesn't seem to be the case. For cannabis, somewhere like 1 in 20 people report that they were exposed to some sort of violence when they tried to buy drugs. Now, in countries such as the Netherlands, where there's a fairly regulated market, that hardly ever happened. And in fact, rates of violence in countries such as Australia and Denmark, even America, were very low. But look at the rates of exposure to violence in countries like France and Germany and Switzerland, 7-8%. That kind of makes cannabis potentially a fairly risky thing to purchase. And even a country like Spain that has particularly cheap cannabis also came out as well above average. Now, you might think that some drugs would be associated with greater rates of violence, and certainly it seems that some drugs in some country are much more likely to be associated with violence. So here we've got cocaine. It looks like buying cocaine in Switzerland is a risky proposition, with 12-13% of people reporting exposure to violence. And again, France and Germany, exactly as with purchasing cannabis, being a particularly dangerous place to purchase drugs. Spain again, despite fairly cheap cocaine, didn't seem to be that safe. And again, there is a consistent pattern here looking at MDMA, with more dangerous purchase from drugs in Germany, France and Switzerland. Now, we just don't know why that is. Is it because of a more violent criminal fraternity? Is it that people are having to do more street dealing? We just don't know. But of course, it highlights the fact that not only is buying drugs risky in terms of getting caught by the police, but also the people you're buying drugs from sometimes might not be that nice. And I guess that's one of the reasons why one of the key things that came out of the Global Drug Survey Highway Code was the importance of selecting your supplier carefully, not only in the belief that people were getting better quality drugs, but maybe possibly because people felt safer. We've got some other things that you might find interesting on the website. We're looking at drug prices and value for money. We've got some very interesting data on cannabis and alcohol, which, is the world's favorite drug, doesn't come off as a drug that's without risk. And we'll also talk a little bit about internet, drugs, research chemicals, and legal highs. As ever, if you've got any ways of improving Global Drug Survey, please email me at adam@globaldrugsurvey.com.